My name is Uma Krishnamurthy. I'm the consultant gynecologist at East Lancashire Hospitals and the lead for colposcopy services here. We are a large trust and there are two hospitals under us, the Royal Blackburn Teaching Hospital and the Burnley General Teaching Hospital with the Women and Newborn Centre here, which is where the colposcopy suites are located. We cater to a large catchment population of nearly 600,000+ and across a wide health economy. And our colposcopy services serve about 4,000+ women every year. Half of them are new referrals and the remaining half are the follow-up appointments. So the ZedScan experience at East Lancashire has been a journey that is still ongoing for us. The business case aspect has been different to the evaluation aspect. As clinicians, we are very much used to running the evaluation, adapting and embracing technology is not something new for us, and we always welcome that. And that was not the difficult bit at all, especially having known about the ZedScan and being convinced of the positive outcomes both for the clinician and the patient. That adoption into the clinical setting was absolutely seamless, no problems at all. But when it came to the business case development, the Zilico team have been fantastic. The Zilico team used the NHSI health economics tool as well, which was very helpful in developing the figures for the business case. And our own divisional business manager and deputy business manager, as well as a finance manager, have been extremely supportive of the process. The benefits were very clear. It was health economy wide financial and efficiency gains that was evident. More than £340,000 over a 3-year period was the gain that was predicted when we put the business case together, but it was the efficiency gains that were most starking, with the ability to reduce the follow-up appointment slots by close to 2,000, nearly 1,860, or as a minimalistic estimate or more. That was what was most attractive for us, because we were already experiencing capacity issues with the increased referrals. We know that the NHS is a very complex organization and it is the largest employer, and for the right reasons there are tiers and tiers or layers of governance there, which is meant for the safety and quality to be safeguarded at all times. But sometimes they can also pose not barriers, but they can limit the progress at the pace and rate that we would like to see. So we had to take the business case initially after all the co-group discussions and presenting within the colposcopy operational groups. It was submitted to our specialty board, which is for our directorate, and then it had to be taken subsequently to the divisional management board. So it was ratified through both the groups, and then it had to go to the trust level, which was the business review panel. There was a business case review panel. So it went to that panel. They had suggested some revisions and all that. So we had to come back, go back to the activity figures, make some changes, update it. But these meetings don't happen every so often. They are once in every 2 months or whatever, and that delays things as well. So we waited for the next business case review panel and it was submitted there. Then it went to one of the trust finance group meetings with the business manager. New business manager was in place by then, and she represented us. I went to the previous meetings to move the case forward and to answer any clinically relevant questions. And one of the things we need to remember is the people in the panel, they don't know anything about colposcopy or ZedScan. So we have to start every meeting, we have to start from the very beginning, and we shouldn't get tired of doing that. So we are the champions and ambassadors of our services, and we need to promote that every step of the way. And now it has been included within the discussions through the contracting and commissioning group, so that it gets agreed into the commissioning and contracting process. And I'm waiting for that approval to come through. The support from the trust team, the division and directorate have been fantastic, and the Zilico team were behind us all the way. And If I were to give some tips to my colleagues, I would say first have an awareness that things are not going to be easy and it will take time. Be patient. Start planning the business case well ahead. Use the actual activity figures you have. Even though you will get the NHSI projected figures from Zilico, use the real-time activity figures as well. Make sure you've added the projections to include the increased percentage in new referrals with the primary HPV implementation within the business case, which is crucial. And this is one of those business cases where, in addition to the financial gains, it is efficiency gains that trump. And that is something I came to learn. You have to highlight the efficiency gains with the limitations of the colposcopy, how it can add to the patient experience, how it can reduce the number of punch biopsies with the benefits on pathology pressures, financial gains, patient experience gains, and also release pressures on the colposcopy services itself with reduced biopsy rates. From a 95% biopsy rate, if you were to go to a 25% punch biopsy rate, it will have a significant impact on the administrative side, pressure on the administrative staff, and the likelihood of delays and missed results, which somebody has to chase up. All of that becomes much more easier. So it's efficiency gains that trump although the financial gains are significant. I just wanted to highlight that and just gain an understanding of what the organizational layers are early on, which I didn't do. I learned along the way. So I'm grateful to the Zilico team as well as our trust team for having supported our journey so far. And I just hope and rest assured on a positive take that we will soon have ZedScan in clinical practice to benefit our patients and the clinicians and the wider health economy.